Good day, everyone. Today, we will be presenting the social, economic, and environmental issues related to digitalization of healthcare in the Philippines. Our discussion will address the challenges, recommend actionable solutions, and identify responsible sectors involved. This presentation highlights how healthcare organization impacts society and aligns with the technological and economic developments, particularly in a developing country like the Philippines. So let's start with the social issues surrounding the healthcare digitization. The first challenge we face is inadequate technology access. Limited internet connectivity, especially in rural areas, makes it difficult for people to access telemedicine and other digital healthcare services. Well, in fact, around 60% of Filipino households lack reliable internet. So, to address this, we recommend increasing government spending on ICT infrastructure, particularly in the rural areas. Public private partnerships between the local government units and the telecom companies can help bring the internet to underserved regions. The key sectors responsible for this initiative include the Department of Information and Communications Technology, or the DICT, the LGU, or the local government units, and the private telecommunication firms. So next is the low digital literacy is the another social barrier. So many healthcare providers and patients do not have the skills to use digital tools. Only 6% of Filipino aged 15 above possess basic internet skills. To overcome this, we suggest integrating digital health education into school curriculums and offering IT training programs specifically for healthcare professionals. The Department of Education, or the DepEd, on Higher Education, or the CHED, medical schools, and local non-government organizations, or NGOs, should collaborate to make digital literacy accessible. So lastly, we have privacy and trust concerns. With increasing digitization, the issue of data privacy has become more significant. Studies show that 90% of Filipinos worry about unauthorized access to their personal health information. To address this, we recommend enforcing stricter cybersecurity laws and frameworks. So, the National Privacy Commission, the DICT, and the DOH, or the Department of Health, must take the lead in safeguarding the patient data. Moving on to the economic issues. The first challenge we have is the high cost of digital infrastructure. So, hospitals and clinics face high upfront costs to implement and maintain digital health systems, including the telemedicine and the EHRs. So, the costs of digital equipment, software, and licensing fees can be a significant barrier, particularly for smaller healthcare facilities. To address this, we recommend reducing the tariffs on the digital health equipment and simplifying the licensing process through the Joint Memorandum Circular, or JMC. So, public private partnerships can help fund these initiatives, and the Department of Finance, or the DOF, and the ARTA, or the Anti Red Tape Authority, should play a key role in this. So, next is the economic disparities in the healthcare sector are also a major issue. So resource allocation is often uneven, with rural regions receiving a fewer funds for digital health. So this leads to a gap in the quality of healthcare between the urban and the rural areas. So to rectify this, we recommend restructuring the healthcare budget to prioritize underfunded areas and provide subsidies to rural health facilities. The DOH, the NEDA, or the National Economic Development Administration, and the local governments must ensure a more equitable distribution of resources. Turning to the environmental issues, one of the major concerns is the e waste generation. Healthcare facilities frequently replace outdated digital devices such as computers, monitors, and diagnostic equipment. This leads to a growing problem of the e waste. So, improper disposal of these devices can harm the environment. So, to address this, we recommend implementing e waste recycling programs in healthcare institutions and partnering with certified recycling companies. So, the DENR, or the Department of Environment and Natural Resources, along with the hospitals and recycling firms, must take responsibility for managing e wastes. So, another environmental challenge is the high energy consumption. Data centers and healthcare IT systems consume significant amount of energy. So this contributes to higher carbon emissions. To mitigate this, we recommend transitioning to renewable energy sources such as solar or wind energies for healthcare facilities and IT infrastructure. So the DOE or the Department of Energy and the energy companies should work closely with healthcare institutions to implement the energy efficient systems. So, in conclusion, the digitalization of healthcare in the Philippines brings promising benefits such as improved healthcare access, better resource allocation, and enhanced service delivery. However, it also introduces challenges that must be addressed across social, economic, and environmental dimensions. So, to summarize, our recommendations are as follows. First is to strengthen the ICT infrastructure and integrate digital health education to bridge social gaps. Next is to address the economic challenges by extending supportive policies, reducing the costs, and promoting energy efficiency, and implement sustainable practices to manage environmental risks, such as transitioning to renewable energy and addressing e wastes. So, achieving these solutions requires the collaboration of different sectors, including the government agencies like the mentioned before, as well as the private institutions and as well as the academe. By addressing these issues, we can create an inclusive, affordable, and sustainable healthcare system for all the Filipinos. So to make our group's output accessible, we've included a QR code and a link to view the detailed analysis and references supporting this presentation. So thank you for listening to our presentation on the digitalization of healthcare in the Philippines. With collective efforts from different various stakeholders, we can harness digital technologies to build a resilient and equitable healthcare system while safeguarding the economy, society, and environment. So together, let us embrace innovation responsibly for the betterment of healthcare services in the country.